closer look at childcare. All right, so let's quickly go over our agenda. We have an action-packed agenda today, a lot to cover, and we will be taking a little bit over 2 hours to get everything done, but don't worry, we built in a break for you to give you a little bit of breathing room. But what we're gonna cover today, first of all, is we're gonna go over our points tally and just sort of see how everyone's doing. As you'll recall, we mentioned that logging into Thinkific and completing the lessons, joining us here in the meetings, there's lots of different ways that you can earn points, and then you're gonna get a prize at the end of the program. After that, we're gonna have a quick recap of where we've been with meetings 1 and 2 and chapter 1 and what we've covered so far in chapter 2, as well as the office hours session that we held. We're gonna have a little breakout room discussion to give you guys just a chance to sort of say hello and meet a couple new fellows that you may not have interacted with before. I'm going to do a really quick introduction to early childhood mental health and just look over some of those pieces. Then we're going to jump straight into our first panel, which is going to give you a firsthand look at what early childhood mental health and dealing with issues like preschool suspensions and expulsions look and feels like to a parent and also an early childhood mental health consultant. After that, we're going to hear from some researchers doing some really, really interesting work related to suspensions and expulsions in the state of Arkansas. We'll hear from them about their research. We'll have another breakout room discussion, and then we're gonna finish off the day with a panel of experts from 2 states, and they're gonna talk about some of the things that their states are doing in order to address some of these issues in early childhood. And then finally, we'll wrap up and gear you up for tomorrow. So first off, let's do a quick points overview. Drum roll, please. These are our top 5 fellows as far as points go. Rep. Marianne Shellcross-Smith is leading the way with 74 points. We got a tie for second place with Senator DeMario and Rep. Pulsifer at 70 points, and then Rep. DeMuth and then also Karen Smith are tied for 3rd place with 69 points each. There was also a very, very close tie for 4th place. I think there were about 4 or 5, maybe 6 people that had 68 points. And just for some reference, that's a total so far of 97 points. Don't be alarmed if you're not anywhere near that number. That's if you did absolutely everything up to this point, which there have been a lot of opportunities. So I want to take just a minute to kind of review some of the ways that you can earn points, just to remind everyone that we're still doing this and you still have plenty of opportunities to get your points up there. So some things you could do, you've already logged on to Thinkific. That's one way to get some points. Completing the Thinkific lessons, that includes all of the required things, so all the lessons and the quizzes, as well as those extra pieces afterward, the follow-up and the next steps and the reflection questions and things like that will also get you some bonus points. You could also attend Zoom meetings. You're all here, so you're all earning points right now for being with us, and answer trivia questions, which will be coming up later on today. And then we've also recently sent you an email last Friday about setting up time with each of us, either Jenny, Allison, or myself for office hours. That's another way to get some bonus points with those one-on-one meetings, or the office hours that we held between meetings, or whatever we do between meetings this next time. Any of those extra pieces are opportunities to earn points. Just really want to remind you also that when you're working on Thinkific, make sure that when you get all the way through something, if there's a button to save it or to record what you have done, that you do that, so that we can see on our back end through Thinkific that you actually did complete everything, and we can give you the points for that. Also, keep earning those points. You know, as I mentioned, we got a prize at the end of the program. We're still kind of figuring out what that looks like, but there will be opportunities for more than one person to earn a prize. And, you know, you're more than welcome to go back at any point. If there's something that you missed in Thinkific, you ran out of time and you didn't have time to get to it, feel free to go back. You can still earn points for those things, even though we've already covered them. We're keeping track of everything that you do on there. And also, yeah, just keep it going. You know, if you have any questions about anything, feel free to reach out to us. Again, you know, we're going to have some sort of separate office hours or touch point between this meeting and our meetings in August. We sent you the email with Calendly so that you can, without even really having to contact us, just pop in a time that's convenient for you to chat with one of us about something going on in your state. And we just want to let you know that we're a resource and we're here for you. So congratulations to our top 5 point earners. And as I mentioned, there are lots of opportunities coming up to earn more points, so don't fret. So speaking of points, let's do a trivia question. So we just came back from the 4th of July. So this question is 4th of July inspired. And you can pop your answer in the chat, but really what we're doing is the first person to answer correctly wins. So it might be more convenient and a lot faster and easier for you to unmute and just go ahead and call your answer out. So whatever you want to do is fine, but just know it's the first person that gets the correct answer will get the point. So Jenny, can you read us the question?
Yes. Let's return from 4th of July. We are wondering if you know which small city in Nebraska Congress dubbed America's official 4th of July city, small town in the US.
It's kind of a tough one, and we don't have any fellows from Nebraska, so this is asking you to stretch a bit.
Seward?
Woo! Who was that?
Vargas.
Oh my gosh, that is impressive. Wow, congratulations. You absolutely earned that point. I didn't think anybody was going to get that. I was trying to stump you actually, and Cookie Monster is so impressed. Thank you so much. I'm so glad that you got that.
Do I get a cookie with that too?
So Rep Vargas, I'm curious, we know that Congress made Seward the U.S. 4th of July city because of its celebrations every year. I guess it's a town of about 6,000, but more than 40,000 people attend their 4th of July festivities. Have you attended?
No, I haven't, but ironically, this came up during a trivia game during a 4th of July barbecue that we had. So
funny.
That's hilarious.
So maybe I'm cheating here.
No, so it wasn't that unique a question. Okay, well, at any rate, congratulations. Thank you for playing. And so before we go ahead and get started for the day, we're just going to send everybody in a breakout room and give you just a couple of minutes to just sort of touch base and check in with everyone. We realize that you haven't had a whole lot of opportunities to talk to your fellow fellows, and we want to give you that chance. So we're going to send you to breakout rooms for about 10 minutes. So grab some coffee and feel free to chat, and we'll see you in about 10 minutes.
It didn't pop up on my end, Melissa.
I think Riley is signing people, so you might not have automatically been put into one. We were trying to have like 5 fellows to 1 NCSL person.
Sure. That's fine.
Yeah, there's some NCSL folks that aren't assigned to a room. If you want to go in a room, let me know and I'll just put you in one.
Okay.
Okay.
I wanted us to help, right?
Yeah, just is there an NCSL person in every room, Riley? I had Heather and Jenna assigned to one of the rooms, but as long as they're covered.
Yes.
Okay.
Okay.
How do I get the NCSL background?
Jenny, there's I don't remember. I've done it before, but I need to do that for these meetings. I keep forgetting.
What's her name? Gosh, it's escaping me.
Amy?
Yes, Amy Skinner. Thank you. You can email her and she'll send you the whole, like all of them, plus like fun ones that move.
I was going to say I could send them to you too, but I bet Amy's got more updated ones than the last time she sent them out.
I might have it in my inbox. I can probably find it, Jenna, and send it to you.
Oh, thanks, Heather. It looks like we have a new person from South Carolina that needs a room.
Here we go. You are in luck. It is easy in my inbox to find, apparently.
I apologize. I'm at home and I was having technology difficulty switching over from my State House page to my home page.
Oh, no problem. I just did a quick run over of the agenda and people are in chat rooms or breakout rooms just chatting right now. So you didn't miss a whole lot.
Thank you.
Happy you joined us.
Thank you.
All right, Melissa. Well, I'll be on standby in case somebody has to leave and you want me to jump in.
Thank you. Yeah, Riley, I had initially said, I mean, as long as they're all covered, it's fine. But I had Jenny, Allison, Jorge, Patrick, Jenna, and Heather as people in the rooms. So if you guys do join if you do end up running a group for the second breakout room this afternoon, they're going to be the same people. So I don't know if you noticed in the little rundown, I had people do quick little 30-second introductions for this first one, and the second one they're just going to jump right in and start talking. So
okay,
because they'll be with the same people.
Good, thank you.
I can't believe he got that trivia question right. I'm super impressed.
I'll be right back. I'm going to refill my coffee cup.
Okay. And Senator DeMuth said, or Rep DeMuth, I'm not sure what her title is off the top of my head. She said she's going to need to step away during the meeting, but she'll shut off her video, but still listen in.
Ooh, I love all these fancy backgrounds, capitals. Looks like you could be sitting in the legislative halls somewhere. On Zoom.
Yeah.
That's
yeah.
so great.
I see Senator Tanya Williams is on as well. She's on early, which is awesome. So she could listen in to the researchers, and then they coordinated their messages so they could piggyback off each other really nicely.
Wait, did you say something? You're muted. You're muted.
Sorry. Yeah, the background sometimes mess with your head, though. You know,
right.
Shadows and stuff. Yeah.
Especially if you wear a headset, that makes it look weird.
Oh.
back in a minute or two.
Melissa, the breakout rooms will end in just a few seconds.
Okay, thank you, Riley. Well, we are right on time, so that's good.
Hi, Melissa. I just wanted to say hello.
Hey, how are you? I'm so glad you made it. Thank you for joining us today.
Oh, my pleasure. Looking forward to it.
Oh, it's going to be great. I'm so excited to hear everyone speak.
I think we're all back, Melissa.
All right. I hope you guys had a chance to chat and just sort of say hello and maybe meet someone new that you hadn't chatted with before. And so now Allison is going to walk us through some of the material we've already covered, and we'll just do a quick recap of where we've been.
Awesome. Thanks, Melissa. Just a little reminder of where we've been together. So you'll remember that in chapter 1, we studied family and child well-being, and that's really the core part of the theoretical model of child development. So you learn things about supporting healthy and equitable starts, births and pregnancy, early brain development and that critical period in the early years, and then how subsequent development is closely linked to lifelong health. Other things that we learned in chapter 1 include families' economic stability and the effect of that on child development. And then we more closely looked at some state-specific data to see where your states, what your states are doing or how you're doing regarding policies supporting family and families in early development. And then many of you took the time in Thinkific to reflect. And I just want to say that what stood out to me in your reflections was the important role of support systems for families. And I could not agree more with that conclusion that many of you shared. And then as we moved into chapter 2, we extended our learning to the next level of the theoretical model of child development. So that one level out, including the immediate and influential settings affecting children, both in the home and out of the home, but things like parents and siblings, early childhood educators, and other caregivers. So we learned about the complexities of environmental factors. You learned about housing instability and homelessness and ethnic disparities. We went outside of the home and learned about issues and challenges to the early childhood workforce. And then you had an opportunity to see a few high quality early learning settings. And what really stood out to me in reading what you said in your reflections about chapter 2, many of you just commented on the interconnectedness of so many family and child serving systems. And this is something we're going to continue to explore during our time together as a fellow. And then the other thing that really stood out, which might not be a surprise to any of you, but many made comments about the disparity in wages for the early educator workforce. So today we're going to continue in the learning environments, and we're going to talk about early childhood mental health. And then tomorrow we're really going to take a deep dive into childcare. So we're sort of going to reflect on the past 16 months, how it's affected the field, but really more importantly, what we want to do is have a conversation about how we rebuild and reimagine things to better serve young children and their families. So today we're going to go for early childhood mental health. I'm going to kick it over to Melissa, and I hope you all enjoy the lesson today.
Thank you, Allison. We've covered a lot. We still got a lot more to go. So as everyone knows, last year in COVID-19 introduced a pileup of stressors, as one of our previous presenters had said it, for our children and families that raised a lot of issues. And out of this, one good thing that came out of it was the Rapid EC project was born. That's the Rapid Assessment of Pandemic Impact on Development, Early Childhood, abbreviated Rapid EC. And that's a group of researchers out of the University of Oregon that since April 4th, 2020, have been administering weekly surveys to families with at least one children aged birth to 5 to ask about a lot of different things, ask about everything, ask about finances, ask about their stress levels, ask about their supports, their children's behaviors and what they're thinking, and just really a really great opportunity to get real-time information for how the pandemic is literally and actually affecting families with young children. So last year, they were administering the weekly surveys. They had a sample of 9,000 nationally representative households across the country. And that was all just during 2020. So I want to share a couple of those results with you now. The first one I want to share is that according to this research that they've been conducting, 42% of households during that time reported that they were worried about paying for one basic need. And that could be like rent, mortgage, utilities, anything like that. And as they reported the increases in material hardship, they were also reporting feeling more stress, anxiety, depression, loneliness, all these negative things that come along with it, understandably. Adding to these, we all know that childcare has been an issue and has been largely affected by the pandemic. And the results indicate that 40% of the parents surveyed said that they were worried that they weren't going to be able to return to work because of a lack of childcare, which we're going to talk about a lot more tomorrow. So I'm just going to gloss over it here. And also what came along with this is everybody spending a lot more time at home together, which unfortunately has led to a lot more stress and strain and anxiety and depression and all of these other things. So much so that 60% of families that responded to the surveys, and this is independent of race, ethnicity, income level, anything, 60% across the board said that they had increases in family conflicts, and over 50% said that they had increased stressors and conflicts with their children. So just kind of keep that in mind as we're working through all this and just putting all these pieces together. And so finally, what that means, right, is that those stressors are interrupting caregivers and parents' opportunities and availability to be nurturing and sensitive with their children, which also leads to their reporting that 52% of the children were experiencing some sort of emotional distress. So it's this really crazy chain reaction that's really all been boiling down to kids feeling really stressed out. So that was all just data from 2020. I also wanted to share with you some information from a more recent report from the Rapid EC team out of Oregon. And so this year in 2021, they've moved to surveying families every other week. And so we have not quite the same proximity of data, but they have that data along with the data that they've had before. So they have an incredible database of this real-time information on how the pandemic is affecting families. So much so that now they are surveying over 1,000 families every other week. And their pool is now up to 10,000, over 10,000 unique families in all 50 states. So this is really great information representing the entire country. So it's really a really great and robust data set. So what we know from a research publication from just June of this year is that 25% of families surveyed said that they were experiencing debt and unpaid bills. And that could be anything from rent, mortgage, utility, medical, credit card, or other bills, as well as borrowing money from friends and family. So of these families, so of that 25%, over half said that their debt and their unpaid bills have actually gotten worse throughout the pandemic, which is leading to a lot more of the stress that I just mentioned. Unfortunately, this recent report also highlights ethnic and racial disparities, with 35 and 34% of Black and Latinx families reporting this stress and this unpaid debt and these unpaid bills as compared to 23% of white families. And I just want to mention also, it's not all bad news. We have done things to help. The stimulus has helped, and families reported that the stimulus has helped. 86% of them reported using stimulus funds to put towards some of this unpaid debt and these unpaid bills. For those families, though, that continue to have these stressors, the ones with the more unpaid debt and bills that they had, the greater emotional distress they were reporting. So it's still very much a real problem. Even though the stimulus have helped, some families still need additional help. So again, I just want to reiterate that this really all brings it down to not only piled up stressors and things that just kind of keep compounding, they've been compounding and they've been there now for over a year for these families, which is again, all leading back to children also experiencing a lot of emotional distress. So I keep saying emotional distress, emotional distress. What does that really look like in children? It could look like any of these things that you see on the screen. It could be depression, conduct disorder, even like PTSD. So some really serious issues. And how prevalent is this really? You're kind of saying, all right, well, yeah, there's an issue, but how widespread is it? It's very widespread, unfortunately. It's a much larger number than I think anyone would feel comfortable with. According to the Centers for Disease Control last year, so this is last year's data, 1 in 6 children between the ages of 2 and 8 were experiencing some kind of behavioral, emotional, or developmental disorders such as anxiety or depression. And unfortunately, that story gets worse when you look at socioeconomic disadvantage, with 1 in 5 or over 20% of young children in families of socioeconomic disadvantage having one of these disorders or one of these diseases or suffering emotionally. So what does this mean for the child or preschool context? Let's think about that. Families are really stressed out. It's funneling down to the children. Children are experiencing all of this distress. A lot of providers have also been experiencing their own personal distress as well as professional distress with all the changes and all the disruptions that COVID has introduced to the field. And a lot of these providers are also not equipped and they don't have the skills to deal with children that are experiencing this level of distress. So unfortunately, what that ends up meaning is that a lot of these children end up expelled or suspended. So luckily, I would like to quickly poll you and see if you can guess what this looks like, the extent that children are suspended and expelled. So I'll give you just a quick minute. Looks like we've got, yep, people are responding. I'm going to give you one more second since a lot of responses pouring in. Getting some changes. Okay, I'm going to give it, yep, we still got a few trickling in. Looks like it's pretty close to, yep, 3 times as often one, about the same rate, was also very close. The correct answer actually is C. Compared to K-12 students, children in preschool are expelled or suspended 3 times as often as K-12 students. So just something to keep in mind, and certainly alarming statistic if you didn't get that one correct, even if you did. So luckily, there are some supports that we can put in place to try to mitigate these things and to try to address them before they become issues. And that's early childhood mental health consultation. So in early childhood mental health consultation, you might also hear of it called infant and early childhood mental health consultation. Licensed medical health professionals work with early childhood educators and parents to distinguish age appropriate from more worrisome behaviors like depression and withdrawal, to anticipate and avoid unwanted behaviors in the classroom, and also intervene before these behaviors occur, and also to create inviting and nurturing early childhood settings and environments for children, but then at the same time to recognize when you think a child might be needing additional supports. These services have been demonstrated to reduce suspensions and expulsions, as well as reduce teacher burnout and stress, which is really, really nice to know and very important because there's also the racial and ethnic disparities with suspensions and expulsions. So only 19% of African-American children make up the preschool population, but 47% of those children suspended and expelled are African-American, come from Black families. Also, boys are disproportionately represented in such that they make up 75% of all suspensions and expulsions in preschool. So just kind of keep those figures in mind as well when we're thinking about these issues. So obviously COVID has really significantly impacted these services and these situations. And a lot of providers have moved to telehealth, which has had pros, right? In that they can reach communities that are further out, a little more distant, because they don't have to drive there. It's a lot easier to log on to the computer and provide those services. But at the same time, they're not able to recognize everything going on in the background. And there may be some things that they're missing that could be related to abuse, or maybe even just other contexts that they're missing that could help them to deliver their services better. So that was a whole lot of numbers and a whole lot of information thrown at you. And so rather than just give you the numbers and all those pieces, hopefully they did provide you some context. Now I'd like to jump into our first panel, where you're going to hear straight from the horse's mouth. You're going to hear firsthand experiences from two amazing, amazing presenters. I'm so happy they were able to join us today. We have Dr. Tanette Powell. She's the Director of Equity, Inclusion, and Community at Merriman School. And she's also a parent that's experienced suspension and expulsions in her own family. And we have Rosa Ortiz, who's going to be joining us from the Illinois Action for Children, and she's an early childhood mental health consultant. So thank you both so much for being here. I'm going to jump right in. They each have something that they're going to present with you, and then we have a couple of questions for them. So we're going to start with Rosa. Rosa, are you ready?
Yes, I am, Melissa. And thank you for that information. And it's an honor to be here. And as we see with those numbers, there are so many needs. And so I just kind of want to share what we're doing in Illinois in regards to so many needs that are happening. So again, thank you. It is an honor to be here. I would just like to take a few minutes to share about some of the work I do as an early child mental health consultant and why I continue to serve 0 to 5 years of age for the past 25 years. Next slide, please. Utilizing our Illinois Actions Framework, I had the opportunity to work with the center for over a year. The center's goal was to engage families more and build teachers' capacity around socio-emotional development. I would do observations and would meet with the staff and have reflective learning meetings. I also provided trainings. In addition, I met with families individually, and these meetings included the teachers. I utilized this slide at a parent event where the teachers in the classroom were invited, as well as the parents. Either the director or coordinator would be present. This parent event was very intentional to build stronger relationships between parents and teachers, to learn more about the importance of these critical years and what teachers and parents can do as a team to continue to promote children's socio-emotional development. The parents enjoyed the pictures and the teachers felt pride in their work. I make sure to let them know that they are the expert of their children. In this slide, I explain how the adult brain influences the young child's developing brain. I also asked them to imagine, how would this baby be if she did not have this caring, consistent adult in front of her? After the event, some of the comments from our survey were, I will decrease the time I spend watching useless information on TV, being calm so they can learn to remain calm, talking about feelings. I will decrease reacting when I'm angry. Interact and find more activities to have with my children, not let my day ruin my mood towards my kids. Talking to them calmly. I will decrease my yelling or escalating my voice. I will increase my activity time with my kids. I plan to communicate more and respond more instead of reacting. Play to learn and help regulate her. Next slide, please. Again, I utilize this slide to show their work and to explain to them how the brain is a historical organ and stores our personal narrative. I help the teachers and parents learn some important concepts about the brain. And thinking always about prevention and promoting social-emotional development, I may use the example of domestic or community violence and how this may have a negative impact on the developing brain. I also explained how relationships and our positive interactions matter. If the bottom part of my brain is regulated, then I can relate and reason better. I can learn easier if the lower part of my brain has had positive, calming, and enriching experiences. I need a regulated adult to accomplish this. Next slide, please. In this slide, I am sharing a flyer on the right that the family child care provider developed. This family child care provider wanted to support families to help them reflect and learn how to promote their young children's development. We worked on this project together and collaborated with another program to offer more services from the community. The family child care provider offered a space for the parents to feel safe and supported. Next slide, please. Child care providers are essential and one of the most important jobs now and for our future. This amazing teacher decreasing physiological stress for this child and supporting this child's regulation. This again will support other areas of development, social-emotional, self-control, executive functioning, overall learning, and even his physical health. Next slide, please. We need to continue to invest in our young children. All stages of development are important. However, these years are most critical for prevention and helping children reach their full potential. Children begin joining gangs much earlier. Pee-wee gangsters begin around the age of 10, and some even earlier. Young children are wanting to harm themselves, having thoughts of suicide, and sometimes succeeding in their attempts. We have so much information to say we need to help our children, and we need to help them sooner than later. If not, we will lose our children to violence, drugs, epidemics, illnesses. Dropping out of school and poverty will continue to increase. Next slide, please. 25 years ago, I was paid $11 an hour for caring for young children. Today, our child care teachers' average pay is around the same, many without benefits. When will we begin respecting our young children, young families, and child care teachers in our society? They are not babysitters, they are brain builders. When will the work of child care and infant and early child mental health be important to all of society and not only a few? We are hearing from experts in different fields, mental health, child development, medicine, experts in economics, and how the stage of development is and how much of an impact it can have on our future. We can't wait anymore. In the past 30 years, we have much more research in neuroscience and in other fields showing we must invest in our young children now. This quote from Dr. Gaskell, a mental health expert from Kansas, who has worked with all ages, stated, "I think the need to know infant and early childhood mental health is critical to the health and welfare of a nation. Our young children deserve the very best from us. In turn, they will give their very best for our nation." Thank you today for this being here, for letting me be a voice for young children, their families, and their child care teachers. It has been an honor for me to serve them as an early childhood mental health consultant and to be maybe their voice today.
Thank you so much for that, Rosa. I really appreciate you making the time to be here and for sharing those insights with us. You have a very unique perspective, as does our next speaker. So I'm going to turn it over to Dr. Powell. Also very, very happy to have you here with us. The floor is yours.
All right. Thank you for having me. Old folks say trouble don't last always, but I can't shake it. What they do now, every time the phone rings, I can't fake it. Can still see the hurt in my grandmama's eyes. You just like your daddy. You ain't gonna make it. We all walking around with the trouble. It's a cycle. Feels like we ain't gonna break it. And my mama crying out, Lord, I just can't take it. School said I was bad, so that became my new name. After so many suspensions, you're never the same. Watch the adults around me play the blame game. Laugh like you don't care to keep from going insane. No matter how far removed, I can still feel the pain. 20 years passed, but I can still see the stain. School did more damage to us than crack cocaine. Trauma so deep that it runs through my veins. But this ain't strange. This is as normal to Black as normal as Seattle sees rain. Y'all don't see us. So the trauma remains. I start there because not only am I a mother of sons who were suspended in preschool, I'm also a child who was expelled from preschool when I was 3 years old. And I find it interesting, and I'll borrow from Ta-Nehisi Coates that, you know, it was the 1990s, it was 2014 when my kids were suspended, and it was today, right? That as we are together today, and as we are talking about mental health and early childhood education, it is still legal in this country to suspend and expel 3 and 4-year-olds. So it's a hard conversation to be having today as we talk about mental health, when we know that there are still things that are unjust. That even as we have this conversation, you know, in certain parts of our country, we can't talk about critical race theory, which is a lens that allows us to look at the difference between what is legal and what is just. That's exactly the conversation that we have to be willing to have today. That before we can really dig into how we support children, how we support, you know, mental health and wellness, that we have to think about what policies we have in place that are unjust, that will continue to reap nothing but mental illness, nothing but trauma and collective trauma. And so I start there because I think that we have to be willing to think about what our role is in this. That before an early childhood educator ever walks into a classroom, there are already policies and practices that make it so for, you know, young Black children, young Black boys, young Black girls to be pushed out of school before they ever enter the space. And so we want the support, right? We absolutely need to be thinking about how we do better in the classroom. But before we think about the classroom, how do we back up and think about the conditions that we've set up in the first place? And I guess the last thing I'll say, and I want to allow times for question and conversation, I just want us to think about the impact over time. That it's easy for us to read the statistics and to say, well, you know, there's a school to prison pipeline, that the more often that a child is suspended, the more likely that child is to end up in prison. We know that data. That data is not new. It's been around for a very long time. But we have to wonder, when are we going to do something about it? How often are we going to come together, have this conversation, get a lot of the same information? About close to half of us knew that, you know, in early childhood education, the suspension rates are 3 times as more, right? And so as K through 12, so we have the knowledge, right? And even if we, you know, half of us didn't get it, we were kind of close. We knew that there was suspension and expulsion happening in those early years. We have to ask ourselves, how long are we going to continue to allow that? You know, the speaker before me, Rosa, talked about, you know, the pay of early childhood educators. We continue to go back to the same old things of, you know, it was that way then, it's that way now. When are we going to begin to do something different? And I say this because even when I started out with that spoken word piece, I say this line where I said, 20 years passed, but I can still see the stain. School did more damage to us than crack cocaine. Trauma so deep that it runs through my veins. And while that might just sound like something poetic, that is the truth. That is the real life that, you know, in 2014, when my oldest 2 sons, who were 3 and 4, were being suspended from school, you don't wake up and say, it's the system. It is policy. It is, you know, somebody else. You wake up and you blame yourself. You internalize that, right? You begin to think about what is wrong with me or what is wrong with my children. And so you begin to think at the very young ages of your children that something is wrong. And you internalize that. And what ended up happening for so many families that I've worked with is that from the sharing of one story or from the sharing of data, as we saw in 2014 when the US Department of Education released the data on the disparities, you know, that, you know, Black students were making up about 18% of all preschool, but accounting for nearly half of the suspensions. That's a moment where you say, well, what's going on? What's wrong? But for parents, you carry that weight because you know what the statistics say, that you can't stop there, that just because you transition and you're like, now, okay, this is a problem happening all over the country. You got to figure out how are you going to push your kids out of that pipeline, right? That that is designed for them, that is designed to push them out and propel them into prison. How are you going to push them out of that pipeline and still be well? So as we have conversations about the mental health and early childhood education, we have to be thinking about not only the mental health of our young children, not only the mental health of our educators, but the mental health of these families, in particular Black families, because the toll that it takes on a parent is damaging. There is a collective trauma that never ends, that even though my kids have not been suspended since 2014, every time there's a phone call without context, an email without context from a school, it takes you back to 2014. That every time I have an interaction, it takes me back to the early 1990s when I was in school, right? It takes me back. And I have to go through a process of how I'm going to breathe more, of how I'm going to center myself, to tell myself, you are not 3, you are not 4. This is not 2014. Your kids have not been in trouble in a very long time. That's what we're expecting families to do. And we call that resilience. We celebrate that. But that is violent. That we live in a country that celebrates resilience, which means that they had to overcome some level of trauma instead of saying, how do we end the trauma? So I hope that as you continue this conversation today, you will ask this question over and over. How do we stop the trauma? That to be, right, responsive, right? To be someone who wants to center the mental health of our youngest children, we have to go to the root. We can't put a Band-Aid on it. We can't hope that maybe they'll push themselves out of the pipeline. We have to think about the root. That right now in this country, there are 250 preschoolers that are suspended every day. That right now in this country, there is a 2-year-old being suspended for taking off their clothes. That right now in this country, there is a child who threw a toy and did hit anybody and was suspended. That right now in this country, we arrest 6-year-olds. And that right now in this country, we blame those families. We tell them that they should do better, that if they were more educated. Even though statistics show us that when we control for income, right? When we control for all of these things, the racial disparities still exist. How do we stop the trauma? Thank you.
Wow, thank you both so much. You always provide such a unique experience that I certainly don't have. I'm guessing a lot of other people on the line also don't have. Can't thank you enough for joining us today and sharing those very personal experiences, professionally, personally. Let's see. Okay, we do have something from Senator Solomon. Just a quick question. What are the policy options to address childhood suspensions? We are, banning suspensions, any other policies. We're gonna talk a lot about, well, a little bit, I should say. There are, to Ned's point, this is still legal in a lot of places, but there have been a lot more pieces of legislation coming out that are banning suspensions and expulsions, or at least leaving those as an absolute last resort, and really looking for ways to try to mitigate these things before it gets to that point. And then there's also some companion things going on with educating early childhood educators and giving them the supports that they need in order to do those things that I mentioned in my slide a couple minutes ago, where they can recognize these things before they get out of hand. They can work with the families to put plans in place, and they can teach children new skills. And then as the educators as well, to help children and just to sort of know what's normal and what's not, and then to have those skills to intervene when needed and recognize when children need more support. So thank you so much. I really just can't express that gratitude enough for giving us this really personal and deeply affecting look at things. So just in the sake of time, we did answer a question or two in the chat. I think I'm gonna go ahead and move on to our next presenter. Thank you so much, Rosa and Tinette. Such a pleasure to have you here. Really, really happy you're able to join us. And I'm going to share my screen again so that I can queue up our next presenters that Tinette actually queued up really nicely as well, because they are going to be talking about, she mentioned what things look like in the classroom and what's going on in the classroom. So we're going to start there with a presentation from Dr. Todd, Rendell, and Sheila Smith. And they're going to talk to us about some work they've been doing in Arkansas. And then later on in the day, we're going to take that further step back that Dr. Powell also mentioned with looking at the state level and some other things going on at that point. So I would like to introduce Dr. Rendell and Sheila Smith, Dr. Sheila Smith. So welcome, thank you for joining us. And I'm gonna go ahead also and stop sharing my screen so that you can do your thing. You are on.
Great, hi everybody. And thank you so much for giving us a bit of your time today. I'm gonna plug in my headphones to make sure you all can continue to hear me as I talk. Melissa, I can see your face up on my screen, so maybe you'll let me know if I'm audible. I'm good.
You're good.
Great. All right. My colleague Sheila Smith and I are going to share some work that we're doing in Arkansas and a couple of pieces about this. So one, we wanted to share this as an example of how researchers and policymakers, people working in state programs, can collaborate to address the issues that we're talking about today. And then we also want to share the results of some recent research on how early learning programs, what their experiences were during the pandemic, and what we think maybe some of the implications are coming out of the pandemic. So I'll start the presentation off, and then I'll hand it off to Sheila to talk a bit more. If anybody has questions in the middle or wants to talk a little more, please feel free to interrupt us. We're happy to dig in and engage with you. I'm assuming everybody can see my screen. All right, so I'll go ahead and get started. So a bit about how this work came to be. So I work for a nonprofit research agency, SRI International. So SRI grew out of Stanford University and is now an independent research institute. And Sheila works for the National Center for Children in Poverty. And organizations like ours frequently partner with state leaders to help understand policy problems of practice, to help understand the impacts of policy. In some cases, the federal government provides support for this kind of research, and that's what's happened here. So we are partners with the Arkansas Division of Child Care and Early Childhood Education on a child care policy research partnership grant. So the Administration for Children and Families provides funding for us to work together on issues that are important to the state and may have some implications beyond the state. Now, our partnership has been focused on these innovative set of policies, programs, and supports that Arkansas has been implementing for a number of years to reduce the use of suspension and expulsion, and in general, to improve children's social and emotional well-being. We have a set of activities that are moving forward on that, and we were prepared to start our studies in March of 2020 when the pandemic started. So we switched gears to quickly try to understand what the implications of the pandemic were for the classroom, what's happening in classrooms, what does this mean for teachers and for children. So we'll talk a little bit about that, and then we may share some more broader context about the programs in Arkansas and what they're doing. Just in general, for their policy context, I thought that was a great question at the end. So what can we do from a policy perspective? As Melissa said, there are bans. You can say you shall not expel a child from preschool, and Arkansas does that, or gives says that you have to have an extensive series of supports before doing that and need approval from the state. They couple that policy that's saying you cannot expel children without approval with a set of supports. And I think they do a really nice job of understanding that teachers, early childhood educators, they don't want to do this. They don't want to put children out from their programs, but in many ways they are genuinely struggling and need tools to understand how to best support children in a group care environment. Arkansas offers a range of really innovative supports at different levels. And hopefully Tanya, who will be joining later, will share a little bit more about exactly what they do. But they range from broad professional development to really intensive mental health consultation. So all of that is going on in the background, as I said, as COVID started. and we went to collect some information on how the programs were doing. So this survey, and maybe as I finish, I can put a link to our reports on this. We conducted surveys of center-based program directors, teachers in center-based programs and in home-based programs, a representative survey across the state of Arkansas. And we conducted surveys in the fall of 2020, really when the pandemic was raging and at its worst, and then in March of 2021 as things were starting to get better. We also conducted a series of focus groups to have folks talk to us about their experiences and to give us a sense of what was really happening and what those challenges were. So I want to start with some things that teachers reported changed in terms of their practice during the pandemic. So one is that we saw more than half of teachers reported engaging in what we classified as more directive practices. So really that they were telling the children what to do. They were controlling their behavior a good bit more, substantially more than they had in previous years. So this ranges from, repeated admonitions, don't touch each other, keep your distance, but also into assigning them specific activities rather than permitting children to work throughout the classroom and have some choice in what they do, to saying, you're going to work in the block corner for the next 15 minutes, and then you're going to work at the water table, et cetera, throughout the day. The other big change, and this is not surprising, is reducing the access to the program for families and other teachers. That coming into the classroom is a long held part of quality early childhood practice, engaging with families, bringing them in. That had to stop, had to change in many ways during the pandemic. Now, when we talked to folks in the spring, we said, okay, you've made a lot of changes, understood you had to, people had to wear masks and so on during the height of the pandemic. What are you going to keep doing as we emerge from the pandemic and return to kind of our pre-pandemic normal? And this was really interesting to hear what they said. So one, they're going to keep washing those hands, right? That's not surprising, but almost almost 3/4 said we're going to continue with that increased hand washing. 29% said we're going to continue to spend more time outside. That was something that certainly children did a lot more. But we also saw a small but decent number who are saying we're going to continue with these more directive practices. We're going to continue kind of controlling children's behavior and what they do during the classroom, in the way that we changed it during the pandemic. Sheila will talk a little bit more about the implications, but this is something to keep in mind, and potentially opportunities to provide some education and additional training for teachers, as we think this is maybe not the best idea, particularly for supporting their social and emotional development. So what happened to the kids? How did the kids do in the pandemic? So we asked the teachers to share with us their impressions, comparing their groups of children they were working with during the pandemic to previous cohorts. And here's what they told us. So first, I want to point out in the middle of this graphic, this gray bar in the middle. We list a set of learning behaviors and social behaviors. And at the size of that gray bar, those are teachers who said, really, not much changed. Kids are kids, and they're continuing to do what they did. So recognize that's the biggest bar every time. So that kids were able to continue in more or less exhibiting the same social and learning behaviors. That said, we do see an important large number who are saying, you know what, our children showed, really struggled to show strong attention for group activities. They were having trouble showing attention in individual activities. They were having trouble making friends. So it's certainly not the majority of teachers reporting this, but it's a large enough number that I think as we plan for how to best support teachers and children moving forward, to understand that really was the experience for some teachers and children in preschool programs. Sheila, I think this is where you take over. Is that right? Great. All right, I'll pass it to Sheila.
Thank you, Todd, and hi, everyone. So I'll share a few more of our findings. Well, we know that at the time of our surveys, the teachers were really juggling many tasks, trying to keep children safe and follow COVID-related rules that were new, in addition to their already very demanding job as a teacher of young children. So we were very interested in learning about their well-being and asked them about their job-related stress. So we found that in the fall, 40% of early care and education teachers reported that their job was very stressful or extremely stressful in the past 2 weeks. And that did go down a little bit to 30%, still a fairly high percentage for that high level of stress, but a good downward trend. Next, please. Next slide, thanks. So in addition to the learning and social behaviors that Todd talked about, we also wanted to learn about those types of behaviors that challenge teachers. And we define challenging behavior as a repeated pattern of behavior that makes it difficult for children to play and learn. And we found in the fall that nearly 60% of center-based teachers and also the same percentage of home-based providers reported having preschool-age children with challenging behavior. And on average, they reported 2 children. So this also dropped a little bit in the spring and was kind of aligned with our drop in teacher stress. Next. So we also asked teachers about the types of challenging behaviors that cause disruptions in their classrooms or home care settings, either once a week or multiple times a week. And over half the teachers said that 2 types of behaviors were really the ones that were causing these disruptions the most. And these were attention or activity problems that tend to keep children from following basic routines in the setting. And the second were behaviors showing children's difficulty in complying with all of those COVID-related rules. So that might be getting too close to a child or, as Todd mentioned, wandering over to a center that the child wasn't assigned to. And then a third or more of the teachers also said that disruptions occurring this often were caused by children who were showing anger or threatening behavior towards others. So there was a mix, but a lot of it was related to the COVID restrictions. Next, please. So we know that children with disabilities are especially vulnerable to disruptions in the supports that they need to really learn and thrive in early care and education settings. And on both the survey and in our focus groups, some teachers did report that children with disabilities were facing some challenges. So children with disabilities, the teachers told us, received evaluations in a reasonable amount of time, less often during the pandemic. So over a quarter of the teachers reported that. They also received in-person supports for the child and the teacher. That would be a specialist coming into the classroom, working with the child directly, and also providing assistance and support to the teachers who work with the child. And again, about a quarter of the teachers reported that. In addition, some of the teachers, both in the survey and in the focus groups, talked about struggles that children with disabilities in particular were having with the COVID-related restrictions. And here's just a brief quote from one of the teachers in the focus group, one of our focus groups. She said, "Not being able to allow him to go to the center of his choice, he's just not being able to conform. He's fixating on, I want to go where I want to go. And before this epidemic, the children could freely play in centers, and now he has to understand." And I have to say, this teacher was very empathic toward the child. And that is really the stance we heard again and again in our focus groups. We were really struck by teachers' empathy with the children and the restrictions that were imposed. Next. So last finding that we want to talk about is that teachers reported on their use of expulsion and other exclusionary practices. And again, we did see a decline from fall to spring. So in the fall, over a quarter of the teachers reported using at least one exclusionary practice. And these were things like asking the parent to come pick the child up early because of a behavior difficulty, or asking the child to stay home one or more days. And then 7% of the teachers did ask at least one child with challenging behavior to permanently leave the program. There were no expulsions in the spring, so we saw that decline, and also some decline in the use of exclusionary practices. So another good trend we saw. So we'll go to the next slide. And we'd like to briefly talk about some implications. And we think there are a few takeaways from our survey results that apply not only to children in Arkansas, but children across the states. So during the pandemic, there were really multiple conditions in early care and education settings that probably had some negative impacts on children's behavior and learning. And our findings pointed to higher teacher stress, restrictions on children's behavior, and fewer opportunities for them to interact with peers and kind of practice those social skills. And then additional factors, we heard about a lot from Melissa's report from the Rapid EC, that families are experiencing a great deal of stress. And also, we expect that there will be children who will be returning to the ECE setting after an absence. So their parents kept them home, and they're going to have quite an adjustment when they return to ECE settings. So all of this for us points to the need for more supports for teachers. And we've already started talking about that today. Two interventions or types of support with very strong evidence for promoting children's social emotional well-being and positive behavior, and also for reducing expulsion, are, as we've talked about, early childhood mental health consultation, and also effective professional development supports, models like conscious discipline and pyramid model, which combine professional development or group training and coaching in the classroom. And many states are already offering these types of supports, but in many cases, they're not really able to reach all the programs that need these supports. And we're expecting that in this hopefully last phase of the pandemic and beyond, those supports will be available to teachers. We think that there's also going to be a need to monitor the provision of services to children with disabilities to really ensure adequate supports for their learning and development. We really want to see the recovery of those services that help children with disabilities thrive in childcare and preschool settings. And last, as we've talked about, families really need more support. And we think that early care and education programs may be able to help families connect with some of the new benefits like the child tax credits. And there are models like Help Me Grow that also help programs help families connect to important services and supports and relieve some of that family stress. So we'll just go to our last slide briefly. And thank you. Just point out on this slide that we do have links to our reports. We have links to some guidance about how ARPA funds can be used for things like early childhood mental health consultation. And then we have a link to something called PRISM, which gives you some rich descriptions. It's an online resource of states that are using early childhood mental health consultation and some of these professional development supports and Help Me Grow that I mentioned. So thank you so much for the chance to talk with you today, and we're happy to take questions.
Thank you so much. That was so interesting and just so awesome to hear those collaborations between research and state, and how you can take those skills that I feel like a lot of time end up being in silos and really put them together to make a meaningful impact. So does anyone have a question for Drs. Rendell or Smith? They gave us a lot of information. I know it's a lot to kind of swallow. Does anybody have anything, a burning question that they'd like to ask?
I do. This is Representative Wozlowick. I'm wondering if you can talk a little bit about sort of the people who do, the professionals who do the, I can't remember the acronym, the IECMH consultation. Like if you could talk a little bit about, you know, what their backgrounds are or sort of qualifications or that sort of thing. I'm interested in knowing a little bit more about who those folks are.
Sure. Todd, I can start and then maybe you can jump in. That's such a great question because there's actually a real shortage of folks who have the skills to do that. So they're typically master's level, at least trained clinicians. So they have a background in social work or psychology, and they understand mental health, and they understand mental health in young children and parent-child and teacher-child relationships. They have that kind of training. They also typically get a lot of additional training as the program is being implemented and continuing on during their provision of services to understand the early care and education setting and how they can do their work in supporting the capacities of teachers in those settings and families of children in those settings to really support children's well-being.
So I'm looking for there's some other resources which I'll post in the chat that the Federal Administration for Children and Families has put together. We have a range of issues that states can think about as they look to implement early childhood mental health consultation, and some nice interviews with state leaders. Some of our colleagues in Arkansas, Dr. Nikki Edge is one of the folks who's interviewed there. So I will add that to the chat. And that's not a bad, they just have podcasts, right? So you can listen to them in 7 minutes and get a good sense of what the parameters are of things that you need to do at the state level. I want to add one thing for those of you who are thinking about this. Well, so how does this apply to my state? And to say that there are many things about Arkansas that are not typical. I think Arkansas's approach to supporting the social, emotional, and mental health of children is, relative to other states, very strong, right? They have a lot of supports in there. They have a really thoughtful and long-term approach that they've taken to doing this. So as you think through the degree to which teachers in Arkansas felt stressed, the degree to which there are these differences in terms of children's response, we don't know what the rest of the country looks like, but this is happening within a context in Arkansas where they do feel very well supported by the state. So we heard that again and again. The state has been responsive and helping us and make this happen. And they had a lot of other supports around them. So as you think about, where your state might sit, think about Arkansas as being a pretty good scenario, right? There's a lot of good that is going on there and yet still these struggles.
Thank you. Thank you for that additional context. Any other last minute questions? That was a great one. I'm glad that you guys are getting into the conversation and unmuting and asking questions. Do we have any others? If not, that's fine as well. I just want to make sure you have an opportunity to get your questions answered while we have our presenters. All right.
I have a question, if there's still time. This
sure.
is Ruth, Senator Hardy from Vermont.
Please do.
I'm not sure who is the best to answer this question, but in talking about policies that restrict or prohibit expulsions from early childhood programs, we just did a law in Vermont that restricts expulsions of children under the age of 8, but it doesn't apply to preschool programs. It only applies to K-12 programs. And one of the issues with preschool programs is the mix of public and private programs and how they're regulated. So I'm wondering if any of the 4 speakers know of a model or NCSL, of a policy. How do we deal with that mix of public and private and home-based and center-based and school-based programs in early childhood, and prohibiting expulsions, but also providing the support for early childhood educators in those programs?
I can answer that, Melissa. As being an early child mental health consultant, we support in that process of trying to prevent that from happening. And so they do request the child care providers for an early child mental health consultant. And also those expansions of expulsion should be prevented. There is also a process of transitioning in case the child actually has more needs than the child care provider can meet. And so that's really important because I've had centers where there are 3 children with special needs in one classroom. So that is a very hard to meet that need. And so they definitely need more supports around that. And hopefully through having more early child mental health consultants, we can support them in that process. But as you know, it is a specialty, and so it is very hard to find, especially also professionals of minorities.
I'll just mention briefly that we are just writing up a report based on a 50-state survey of expulsion prevention policy, both in legislation and in guidance. There's a mix. Very few states, but there are some, have developed policies that go across the sectors, so childcare and pre-K, but some have, so we'll describe those in the report. The other thing that's a little bit unusual, if you just look at a trend, is very few of the existing policies, and Arkansas is a big exception, tie the policy of preventing expulsion or saying you can't expel children to a requirement that programs ask for help, and in addition to making resources like consultation available. So I think there's room for strengthening these policies where they do exist. And if a state is just beginning to develop their policy, they're in a great position to make their policy strong from the start.
And I'll just mention also, Senator, that Jenny put in the chat that we're going to be talking more about this with Senator Story from Colorado a little bit later on too. So you might want to revisit that question and bring it back, and she can give you some additional information. So I want to thank our presenters so much. Thank you so much for bringing your expertise to us and sharing that with us and taking the time out of your day to do so. And for everyone else, we are going to take a quick break. So we'll give you about 5 minutes. If you come back at 25 after, we will jump back into some breakout rooms, and you can have an opportunity to reflect on everything that we've seen and heard so far today. So enjoy your break. Thank you so much.
Bye, everyone.
Thank you. Bye.
Thank you. Thank you so much for being here. We have with us today Tanya Williams, who actually worked and is continuing to work with Todd and Sheila, who we just heard from a few minutes ago. She's the director for the Division of Child Care and Early Childhood Education in the Arkansas Department of Human Services. And then we're also going to have Senator Tammy Story joining us. She's part of the Colorado General Assembly. So I would like to turn things over to Tanya to get us started. The floor is yours.
Thank you, Melissa, and thank all of you for being a part of this. This is really exciting for those of us who live and work in the early childhood space and are big supporters of early childhood mental health, or as I refer to it, as social emotional development in early childhood. I just have a couple of slides. I'm not going to bore you with the details on these, probably, as you've heard a lot about, but Melissa, if you'll go to the next slide, I do want to focus on, the why, and I'm not going to focus on the first 2 bullets. You can read those, but I do think there's this space. This is really about human capital. You all have been studying and learning about child development and brain development. And when I think about the work, it's really about human capital and making sure that all young children have an opportunity to start at a great place and have all of the wonderful experiences that will help them become productive citizens in our state and in our country. So I just wanted to say that I know there have been some good slides about that and the return on investment. So I just think that's a really important one to focus on, that if we can continue to work in this space and get this right for young children, it really helps the whole pipeline, you know, from early childhood to K-12 to career. So just wanted to point that out. And Melissa, if you go to the next slide, I do have just a little bit of history. You heard from Sheila and Todd, and they were very complimentary, and I really appreciate that. But I do want to point out that even though we do have some policies, there is one in our state-funded pre-K program that prohibits programs or encourages programs to not expel or suspend young children. We equally have put that in our federal child care development block grant in the past few years. We still see programs who are struggling and sometimes, in fact, do suspend and or expel children, but it is very minimal. But the work has been going on for many, many years. I mean, there's a foundation that was laid even before I came to this job 17 years ago, back in the late 90s, early 2000. We started funding an early childhood mental health consultation model. And we had early learning standards for both infants and toddlers and 3 to 5 year olds. We also had training available that really focused on social emotional mental health or social emotional development in young children. So as we moved over and started evolving the work that we had in the mental health consultation model, you know, we had a lot of work with state-funded pre-K and Head Start programs. We really wanted to broaden that out to all early childhood programs. And so, you know, we focused more on this prevention of expulsions and suspensions in that space with our early childhood mental health consultation model, and really took it across to the programs. So that has really, you know, invited some opportunities for us to continue to hone in on, you know, areas of supports for programs and things that we can do to improve both the services as well as the policies. We also combined our early learning standards probably in about 2014 or 15. Those became one birth to 60-month document for children birth to 5. So because we have programs that serve infants and toddlers in preschool, and some children developmentally are in different places, and we really need our program people to see across the development. So we're really excited. We had those vetted nationally, and I think they're a great set of early learning standards. And we have training with those because that really is foundationally where everything starts, helping people understand what is normal development, what's normal social emotional development in young children. We also have a lot of training. I've included a couple. I did not consult with Todd and Sheila about conscious discipline, but we added conscious discipline probably about a decade ago. And I'll tell you the reason. I heard from 30-year veteran teachers who said, I wish I'd had this training 30 years ago. And so it's a big support to our social emotional work that we do. But we also have training for families. And I think Sheila and Todd had that on their slide. So we continue to work with our partners, both Todd and Sheila, but we equally have evaluations in our state with Dr. Nikki Edge, who Todd referenced. I just want to, just a couple of things, and I want to hand it off to our next person who I know has some great information from Colorado. But one thing I would say to you as policymakers, you know, it's really important to think about where things sit in states, and they're all very different. And so for us during the pandemic, our state pre-K program is at our Department of Ed. And so some of the things that you heard were not directives really from us, but it is sort of working together to make sure that we're all consistent. I have, I think, testified several times at our state legislature that we work with young children and they're going to touch things and you know, they sometimes lick the floor. They put things in their mouth. That's pretty normal development for little bitty children. And so we never expected children not to engage with one another in early childhood classrooms during the pandemic. It's really hard to put things in place. We never had requirements. We did have to put some things in place to protect teaching staff. And, you know, there were some, I would say, you know, the best guidelines and requirements that we could put into place, but it was never about separating children and creating situations that would stress teachers. So, but the work that we've done with Todd and Sheila helped us in the period to make sure that we went back to our providers to support them and respond to questions and to give them better information if they were in fact doing things that were more prohibitive, to say, hey, you don't have to do that if that's something you want to do in your program, but that might cause more problems in your program. So we were able to use a lot of that. We were also able to work with special ed at our Department of Ed for some of the messaging as well. I know you heard some things about that. We are seeing some referrals. We're starting to see, we had in-person school last year. A lot of things went back to what I would say is fairly normal for our state. We did start to see a few referrals coming in, more coming in maybe than what we saw in 2020. But we are seeing over the summer a pretty large number of school age referrals. And our work has really been on early childhood. And so we're working across with our Department of Ed to make sure we address that. So just putting that out there, that it's really across the spectrum of development and not limited to just early childhood. So I'll stop there. I'll be on the call to take questions. And thank you so much, Melissa, and all of you for being a part of this.
Yeah, thank you. It's so nice to have you here to compliment what we just heard from Todd and Sheila. And I think you brought up some really great points. It's not just early childhood. It's not just 0 to 3. It's not just 3 to 5. It's really across the continuum. And so I would like to hand it over now quickly to Senator Story. If you have anything you'd like to share with us, you are more than welcome to do that. The floor is yours.
Thank you so much, Melissa. And it's a pleasure to be here. It's exciting to have an opportunity to share a little bit about what Colorado is doing in the realm of early childhood care and education. I'm a senator in the state of Colorado, and there are 35 of us. So I have a portion of kind of a transitional area that's not urban, and it's has a little bit of suburban, but also working towards rural, but it's neither rural nor urban. It's sort of combination of all those things. And so I wanted to share with you, first of all, Colorado has not had universal preschool. We don't have it right now. We are working towards it. There has been some legislation passed so that we will be implementing that soon and providing that for 4-year-olds to start with. So that's really exciting. I think we all recognize the need and the importance of that for our kids in their very formative years. But we've also had some legislation along the way to try and ensure that we can support early childhood care and education also. And we have an extreme shortage of that, even before COVID here in Colorado. The infant care in particular, we have about 1 seat for every 5 person needs, infant needs. And that's pretty horrific, as you might guess, that it really keeps people from being able to get back to work or to work at all. And COVID just exacerbated those situations as well. So last year, when we were in the midst of COVID, we passed a bill that was, we had been working on it, but then we adjusted it and altered it. It had a pretty significant fiscal note. We needed to cut that. And we adjusted it relative to really focusing on the early childhood workforce. And supporting those, childcare programs that were out there and trying to get them to reopen to serve children and families so that folks could get back to work. There also was an element to provide mental health needs for not only caregivers, but also for children and families that were in crisis, relative to economic or health trauma crisis, the disruption of children's learning. And so that was a really important element, we thought also, and providing some greater flexibility with the early childhood councils through our State Office of Early Childhood to really support quality and responsive programming and help ensure that those child care centers or in-home programs had the tools that they needed to be able to function well. So that bill was House Bill 20-1053, and I worked on sponsoring that in the Senate. And then this past year, I worked on a very significant bill to increase the capacity of early childhood care and education. Like I mentioned, we have had, a pretty significant shortage of opportunities out there for licensed care. And so there's a number of different elements in that bill. And the first one utilizes general fund dollars, and it was all about having employer-based childcare facility as a grant program to award grants to nonprofits, for-profits, government employees to either renovate, remodel, construct, new or, current on-site or near-site licensed childcare facilities. And part of the impetus there was in our downtown area, for example, many people left their office buildings and went, to work remotely from home and took with them their, young children and their school-age children that were doing remote learning. And there are employers that would like to have their employees come back, but they're struggling to get back because they can't access childcare. So if you had a downtown office building where, a number of different employers were willing to collaborate together and institute a childcare facility within the building, that could help get multiple businesses to bring their employees back. And then other, just even more simple ones, just in communities or neighborhoods or in small businesses, or a collaborative, effort among other small businesses, or even within our hospital facilities. Our medical care centers, many of them don't have childcare facilities either, and they have significant populations of employees. So that was really important. That was state dollars. And then we had several focused on federal fund dollars, several elements. One was focused on recruitment and retention grants and scholarship program to really build back that workforce, because many of those workers, when child care centers closed down or they reduced their capacity, and they closed down because families were going home to work and they took their children with them to just have them in their own care. So we're working to build back that, that workforce. There's also a teacher salary grant program that is part of this, that provides federal funds, but those federal funds that are addressing the salary come from the Child Development Fund at the federal level. It is not ARPA dollars, because as you know, those are like one-time use dollars, and salaries are not a one-time thing. You can't bump up somebody's salary and then in a year or two take it away. So these are ongoing dollars that come from the feds. They have invested more money. All of our states should be receiving a bump in those child development dollars, and we're using those to bump up teacher salaries and assistant teacher salaries to ensure that we can build up that workforce and it can be a sustainable job for people. And then also there's an innovation and resiliency program for allowing for innovation within various different facilities and awarding them with additional grant dollars where they are looking to solve, affordability or accessibility and sustainable business practices to get, more kids back into childcare so people can get back to work. So those are the two bills that I wanted to share a little bit about. I also just anecdotally, these bills had bipartisan support. We felt it was really important to show that level of collaborative effort, not just within, not just under the dome, but that would be a statewide, recognition that we are all getting behind this effort to improve our early childhood care in Colorado. And at the last moment in the Senate Bill 236 that I was carrying in the Senate, my colleague on the Republican side, we invested a significant sum at the very end of the child development dollars that bumped up the total program allocation. And he was just like, oh my gosh, we have early childhood is important, but we have so many things that are so important. We can't be spending hundreds of millions of dollars on this when we should be spending it on transportation. Our roads are a mess or whatever. And I I mean, it was like we were going to the well. It had already been through committee, had passed through committee. We were going to present it on the floor, and he was pulling back, and he's like, I got to get off this bill. And I said, no, you can't. Like, we need you. And so I said, just hold the phone. And I explained to him why there was this, sudden bump in funding, and he had heard it, but he just got really nervous about it. So I said, I will get our early childhood experts in here and we'll talk in 5 minutes. And I want you to hear from them about why this is so important. And so we just huddled out in the hall while there was sort of a pause on the floor, and helped him understand that these dollars coming from the feds, from that child development fund, cannot be used for anything else. They are earmarked for early childhood, and they had to be used that way. And if we refuse to accept them, then we would lose them. We wouldn't have them available for our state. And so we salvaged this in just, 10 or 15 minutes. And he was on board then, and we were able to present it and had, incredible support across the floor for that bill. So, sometimes those things work out, and you have to pull some kind of rabbit out of your hat and make it happen. And I was really glad that it did. So
thank you.
I'm happy to, hear any questions or receive any questions that you all have.
Thank you so much for that. If anyone has any questions, you are more than welcome to unmute or to type them in the chat. I just want to follow up with a quick question though. Senator Story, you alluded to, as we all know, there's a shortage of childcare providers right now. Are you also finding, and this might go to you as well, Tanya, that you're having a shortage of early childhood mental health consultants in your states? And if so, like, what are you doing to sort of mitigate those effects? That, like, what are you putting in place, or what are you considering putting in place regarding recruitment and training and other things like that for the consultants themselves?
That definitely is a problem in Colorado too. And the first bill that I shared about, 1053, has an element for mental health consultants for early childhood. And I worry about how we're going to do this because, already across the country before COVID even started, we don't have enough we're not providing enough mental health services here in Colorado. The need is much greater than what we have available. My daughter is a social worker, and she does trauma-informed therapy. It's a tough job. And that is an element that we're working on. And I know the early childhood office, has some strategies that they are working on, but we have to be willing to, bump up the investment in our institutions of higher ed to get more people trained as counselors or social workers, nurse practitioners, those who can do the mental health consultation. And we need to provide incentives to get them there, and then get them through the program and have mentoring for them. And I know that our Office of Early Childhood is working really hard. They have recognized that this has been an issue, and they are looking at all this legislation that we've passed as a real gift for them. They recognize that there is a tough road ahead, and we will be competing with other states who are looking to do the same thing. So it's going to be a challenge. I don't think we have clear answers yet.
Yeah, Melissa, I would just add, we are, just from the early childhood staffing side of it, we are proposing to use a pretty significant portion of our ARPA, American Rescue Plan Act funding, to invest in the TEACH scholarship in our state. We already have some funding going there from our federal child care block grant, but we're really looking at making a significant investment because we really want highly trained people in the field of early childhood. I think on the mental health side, there's a lot of work going on in our agency at DHS around Medicaid and behavioral health, but even in our state and at our Department of Ed. And so right now there's a lot of let's circle up and make sure that we're coordinating all the efforts, of which my part is don't forget about early childhood in that equation, that we don't lose sight of the fact that we have to think about building out spaces for people to have expertise with young children. We haven't seen it yet in our work on the behavioral health work that we're doing with Dr. Edge, where we're making these referrals and working. But we certainly anticipate with what's happened that we could see a real uptick and that we would have that happen very quickly. So, but that's kind of what's happening here in our state.
Great, thank you. Yeah, please feel free, like I mentioned, throw any questions in the chat. I have another one though, since I don't see any popping up. How are each of your school, I guess I should follow up first with, I'm gonna throw in the chat a link to an article about some early childhood mental health work and some follow-up from some policies that have been put in place in the state of Illinois and how that's looking and some of the findings from that. This researcher that they reference is actually a personal friend of mine as well. And I know she's really great at what she does. So what she told me though also is that she's finding that based on these policies, they are seeing a reduction in suspensions and expulsions in Illinois, but also unfortunately, when you parse things out, some of those disproportionalities that I mentioned earlier and that Dr. Powell touched on still remain. So just sort of thinking about equity and all these things and knowing that these disproportionalities exist, what are Colorado and Arkansas doing? Or, how are you keeping like equity at the center of things? And, is there anything special or anything that you're doing to ensure that equity is kept?
I'll jump out there first. We do have an evaluation component in our behavioral health referrals. That was a big part of it. Dr. Edge is a researcher. She's has a mental health background, but she's really a researcher at heart. And so we continue to monitor for that. But we also want to look at, are the resources available and the supports across the state to all geographical areas? What we are finding, and I don't want to say because it's not a problem here, because I've looked at this research across the country, but our data, it does fall out very high on the male side. So a lot of young boys, but we're not seeing the minority in Arkansas. It's about 2/3 Caucasian. So it kind of tracks probably more along with our state population base than a higher percentage, but that could be because they're not getting referred. That there could be other reasons. So, but it is something that's on the forefront. And the first thing I would say is make sure that you are data collecting this so that you can monitor for it, or you won't even know what to look for. But it is sort of looking at policies. It's making sure that, the people who are accessing our training represent all the programs and all the populations that we're serving. So that's, kind of where I would start with that.
Yeah, there are a number of efforts underway here in Colorado, even before today's challenges, relative to ensuring that we are serving those families that most need to get to work, and our Black and Brown communities, as well as our families in poverty, our rural communities in particular, and the early childhood councils that we have, scattered across the state are really very cognizant of that. They are, located regionally, and so they have a lot of input into trying to ensure that families that aren't getting served do get served, with a focus on that accessibility and affordability piece. And with the funding that we have set up in these bills, they are prioritized, those families, and there's a lot of work going on to communicate out and make sure we reach those families, because not, just posting something on a website or putting it in some kind of newsletter is not going to reach all the people that need early childhood care. So we have been very cognizant of that, and I anticipate that clearly the significant amount of revenue that we have available right now is going to make a huge difference, because without that, you're just always kind of scraping around the edges, trying to accomplish great things with not very much funding. And the funding that we have now, I think, is going to help significantly to bridge some of those gaps.
Great, thank you so much. We are out of time for our panel. I can't thank you both enough for being here and for sharing your experiences at the state level. Really, really useful information. And Tanya, you queued us up for some things coming down the line in Chapter 3. We're gonna talk about some data systems and how to collect data from early childhood. And then of course, Senator Story queued us up for tomorrow quite a bit as well, talking about childcare. So thank you so much to you both for joining us. I am going to give someone an opportunity again to earn a point. It's trivia time. So get ready. Here is your question. Allison, kick us off.
All right. As the question in front of you says, name one of the four first ladies that have been on Sesame Street. So there are four potential right answers. Previous first lady that's appeared on Sesame Street. Anyone have a guess? Unmute.
So there are four trivia points up for grabs.
Or raise your hand. Rep Wicks, is that your hand raised or a thumbs up?
Sorry, I meant to raise my hand. Nancy Reagan?
That is not.
No?
Correct.
It's a good guess though.
Very good. Okay, Senator Hardy?
Rosalind Carter.
No.
Oh, wow.
Being narrowed down. Four previous first ladies. Who else?
Think more recently.
Obama.
Michelle Obama.
Oh, yeah.
Correct. That is one. Who said that?
I think Joy and I, we're both from Hawaii, but yes.
Yeah, Michelle Obama, yes.
Okay. We'll give out another point. How about one more person?
Hillary Clinton.
Correct.
Lady Bird Johnson.
That's what I say.
Nope. The final. So we'll go points for two people if that works. And so it's been Barbara Bush, Laura Bush, Hillary Clinton, and Michelle Obama. So good fun fact to keep in mind. Stump your friend.
Thank you all for playing. So hopefully that broke up the day a little bit, gave you something fun to look forward to, and we got a couple points put out. So congrats to all of our points winners today. And so now I'm going to pass things along to Jenny to wrap up the day.
All right, we're nearly done. Hang in there. We just want to cue you up for tomorrow. We will be talking all things childcare. So we'll have some great folks with us, lots of unique perspectives, parents, providers, administrators, folks who really tangle with the funding and the numbers when it comes to navigating all these complex childcare funding streams. We'll also have former legislator, former early learning fellow, alum turned Connecticut Commissioner of Early Childhood, Beth Bai will be with us. So we've got lots of things to cover. We'll be talking a lot about ARPA funding tomorrow. And we just love your help in sort of helping us to narrow our focus. So Melissa, drop in the chat, or Allison, if you would, the Mentimeter link. Let me share my screen. If there's a particular policy, there's a particular funding stream, issue related to childcare that you want to make sure we cover tomorrow, now is your chance to chime in. So again, follow that link that Melissa dropped in the chat. Enter in, and also you can also just do the chat box here in Zoom if you'd like, but like I said, we've got lots of perspectives tomorrow, people with lots of knowledge. We really hope to get into the weeds because, even if you knew nothing about childcare or about early childhood before you became a fellow, you certainly know that childcare is an issue in your state. And so we can't promise we can solve all the problems tomorrow, but we will get into it. Great, talking about funding, affordability, workforce issues, we'll certainly be talking about. Great. Follow up, I think, from early childhood mental health. I can't imagine that won't also come up tomorrow, right? Because we're going to be talking about supporting the workforce. And as we know that navigating challenging behaviors with children and children with special needs is a big part of helping to support workers. So policies that apply in all the settings. Workforce, love it. Yes. Okay, well, if anything else comes up, how can we get a % of income and family back to pay for childcare? Okay, back to affordability for families for sure. If any other ideas come up, please reach out, let us know. Again, we'll be back tomorrow, same time, same place, talking all things childcare, and we look forward to seeing you then. Anything else, Melissa?
I think that's it. Thank you all so much for hanging in. I know today was a little longer, and have a great rest of your day.
Thanks, everyone.
Thank you.